Hi, this is Dr. Ghalambor from Nortec Spine and Joint Institute. I want to talk about complex regional pain syndrome, or CRPS. It used to be called RSD, reflex sympathetic dystrophy. This is a very serious condition. Unfortunately, it starts very insidiously. It starts like a little ache. A lot of times people don't know what started. A minor injury, maybe a little sprain strain, typically in an arm or a leg. And then little by little, instead of getting better, it gets worse. It's usually associated with swelling, redness, sensitivity to touch, and a pain that is out of proportion of what the problem is. The key is recognition of this problem. And unfortunately, it's not a very common disease, so a lot of people just don't know what it is. And try to tough it up or try to see a physician or a healthcare professional that is less familiar with this. And unfortunately, that could be a big mistake. The key is actually to get on top of it, get on top of the pain. Make sure with with pain control or with the help of a chiropractor or a physical therapist that we restore the range of motion, desensitize that extremity rather quickly, or in the later stages we can have irreversible loss of strength, loss of muscle mass, loss of range of motion, and it could quickly progress or even involve the other side, the other hand or the other foot. So this is one of those that you really can't afford to mess around with it. You quickly would need to get an expert opinion. When I was a fellow at Harvard about 11 years ago, I wrote a small chapter about complex regional pain syndrome published in the Essentials of Clinical Anesthesiology book. And since then, I've been dealing with a couple of patients. I've been fortunate to have been exposed to this disease, had to read about it, the research and the treatments, get myself familiar with all kind of variations of how this disease can show itself, because a lot of us don't get enough real life exposure to this rather uncommon disease. So if you have the slightest suspicion that you may be suffering from this problem, do yourself a favor and do seek treatment with a clinician that actually has the proper training. And I would highly recommend that you see somebody that is fellowship trained in interventional pain management and has a board certification. Thank you so much for watching.